What if I told you there's a disease that could be silently growing inside you right now, showing almost no symptoms until it's too late to save your life? Hello, my beautiful community. It's Dr. Katalyn Cari here, and I'm so grateful you've chosen to spend your time with me today. If this is your first time on our channel, welcome to our health family. Please hit that subscribe button and ring the bell so we can continue this important health journey together. And if you're part of our amazing community already, thank you for being here. Your likes and comments mean the world to me because they help us reach more people who need this life-saving information. Today, we're going to talk about something that absolutely terrifies me as a physician, and it should concern you too. Pancreatic cancer is one of the most dangerous cancers precisely because it whispers instead of screams. It doesn't announce itself with dramatic symptoms. Instead, it quietly advances, disguised as common. Everyday complaints that most people, and sometimes even doctors, dismiss as nothing serious. After more than 3 decades practicing endocrinology, I've seen families devastated by late diagnoses. But I've also witnessed miraculous stories where early detection saved lives. That's why I'm here with you today, to give you the knowledge that could literally be the difference between life and death. In the next few minutes, I'm going to share with you 5 silent warning signs that your pancreas might be in trouble. These aren't the obvious symptoms you might expect. These are the subtle signals that most people ignore until it's too late. I'll also give you 5 proven strategies to catch this disease early and for dangerous habits that, if you eliminate them starting today, could dramatically reduce your risk. But here's what makes this even more critical. There's one particular sign that's almost invisible, one that 90% of people completely overlook, and it might be the most important warning your body can give you. Let me start by helping you understand why pancreatic cancer is so uniquely dangerous. Your pancreas is a humble organ, tucked away deep in your abdomen, hiding behind your stomach and close to your spine. It's about the size of your hand, but don't let its small size fool you. This little organ has 2 incredibly important jobs. First, it produces enzymes that break down the fats, proteins, and carbohydrates you eat. Without these enzymes, your body can't properly digest food. Second, it makes hormones like insulin that keep your blood sugar levels stable and healthy. The problem is its location. Because the pancreas is so well hidden and protected, it rarely shows up clearly on routine medical tests. A tumor can grow there for months without causing obvious symptoms or appearing on basic scans. This is why I call it the silent killer. In the early stages, pancreatic cancer barely whispers. The first changes are so subtle, there is a mistaken for everyday problems. Slower digestion, feeling full after small meals, some gas, a vague backache that comes and goes, or fatigue that we blame on stress or aging. As an endocrinologist with over 30 years of experience, I've noticed another particularly deceptive sign: subtle changes in blood sugar control. Sometimes diabetes appears out of nowhere, or in people who've had stable diabetes for years, their blood sugar suddenly becomes difficult to control. None of these symptoms sound alarming by themselves, but together, they can be the opening notes of something much more serious. What makes this even more challenging is that we don't have a simple, reliable test to screen for pancreatic cancer in its early stages for people without symptoms. Blood markers can give us clues, but they can't confirm or rule out cancer by themselves. The most useful imaging techniques like detailed CT scans or MRI with contrast, and even specialized procedures like endoscopic ultrasound, aren't part of routine checkups. They're only ordered when doctors already have specific suspicions. This is why, in many cases, the diagnosis comes late, when the tumor has already invaded nearby structures or spread to other organs. It's not coincidental that the 5-year survival rate for pancreatic cancer remains low compared to other cancers. Time lost in the beginning has enormous impact on the outcome. Let me share a story that illustrates why awareness matters so much. I remember a woman in her early 60s who came for a routine checkup. She had no complaints and seemed perfectly healthy. However, some small abnormalities in her blood work and a few casual comments about her digestion feeling heavier than usual made me dig deeper. Specific tests revealed a small tumor that was still operable. We caught it in time. She had successful surgery, and today she continues with her regular checkups and a full, vibrant life. Her story isn't meant to give false reassurance, but to show that even though it's difficult, early detection is possible when we pay attention and act without delay. Now, let me share with you the 5 silent warning signs that you absolutely need to know. Remember, none of these confirms cancer by itself, but if they persist or if you have several of them together, they deserve immediate medical attention. The first warning sign is persistent indigestion and abdominal bloating. Your pancreas produces enzymes called amylase, lipase, and trypsin that break down carbohydrates, fats, and proteins. When there's a blockage in the pancreatic ducts from a tumor, or when pancreatic tissue is compromised, the release of these enzymes decreases. This causes slower digestion, feeling full with small meals, gas accumulation, and in advanced cases, greasy, foul-smelling stools. Unlike common indigestion, this problem doesn't respond well to antacids or simple dietary changes because the issue is enzyme deficiency, not stomach acid. The second warning sign is unintentional weight loss. Pancreatic cancer creates a state of hypermetabolism due to tumor cell activity and the release of inflammatory mediators. These factors increase your body's baseline calorie burning while simultaneously decreasing nutrient absorption due to poor digestion. Additionally, tumor inflammation alters appetite-regulating hormones like ghrelin and leptin, causing you to feel full quickly. This type of weight loss is progressive and doesn't reverse easily, even if you maintain an adequate caloric intake. Medically speaking, losing more than 5% of your body weight in less than 6 months without an apparent cause is a sign that deserves immediate investigation. The third warning sign is pain in your middle or upper back. The pancreas sits in the retroperitoneum in close relationship with the celiac plexus and splanchnic nerves. When a tumor grows, it can compress or invade these structures, creating referred pain to the back region. This pain is described as deep, dull, and constant, getting worse when lying down and somewhat better when leaning forward. It's important to distinguish this from musculoskeletal pain, which usually improves with position changes or simple pain relievers, which doesn't happen when the source is pancreatic. The fourth warning sign is jaundice, a visible sign indicating bilirubin accumulation in the blood. In tumors located in the head of the pancreas, obstruction of the common bile duct frequently occurs, preventing normal bile drainage into the intestine. As a consequence, the skin and mucous membranes acquire a yellowish tone. Urine darkens due to bilirubin in the urine, and stools become pale or whitish due to lack of bile pigments. Additionally, retention of bile salts in the blood can cause generalized itching. Tumor-related jaundice is characterized by progressive onset and absence of intense abdominal pain, differentiating it from acute jaundice caused by gallstones. The fifth warning, sin, and this is the one most people miss, is recent changes in blood sugar control. Your pancreas produces insulin through beta cells in the islets of Langerhans, the key hormone for regulating blood sugar. When a tumor compromises this tissue, it can cause absolute or relative insulin deficiency. Furthermore, certain inflammatory mediators released by the tumor induce insulin resistance in peripheral tissues. This translates to the appearance of diabetes in people with no history or loss of blood sugar control in previously stable patients. This type of metabolic alteration, when it appears suddenly in older adults, especially combined with weight loss or digestive symptoms, should be considered an alarm signal. From a clinical standpoint, each of these symptoms can have benign causes, but their persistence for more than 2 or 3 weeks, or their combination in the same patient, requires ruling out pancreatic pathology. Now that you understand the warning signs, let me share 5 evidence-based strategies that can significantly increase the chances of early diagnosis. The first strategy is using advanced and specific imaging tests. Multi-phase contrast-enhanced abdominal CT scans and MRI, with MRCP magnetic resonance cholangiopancreatra are fundamental tools for studying the pancreas in great detail. Multi-phase CT allows obtaining images at different perfusion phases, making it easier to detect hypovascular lesions typical of pancreatic adenocarcinoma. MRI with MRCP provides precise visualization of pancreatic and bile ducts, detecting strictures, dilations, or irregularities that may indicate a tumor process. These techniques far exceed the diagnostic capacity of conventional abdominal ultrasound, which is limited by intestinal gas interference and the retroperitoneal position of the pancreas. The second strategy involves measuring blood tumor markers, with special attention to CA19-9. This antigen is elevated in approximately 70 to 80% of pancreatic cancer cases, although it's not specific, as it can also increase in benign conditions like cholangitis, pancreatitis, or liver diseases. Still, its usefulness lies in that, combined with clinical and imaging findings, it can guide the need for deeper studies. In monitoring high-risk patients, a progressive increase in CA19-9 should be interpreted as an alarm signal justifying immediate evaluation. The third strategy is periodic surveillance in higher risk groups. This selective screening is recommended for people with family history of pancreatic cancer, associated genetic syndromes like Peutz-Jeghers syndrome, BRCA1 and BRCA2 mutations, or PALB2, chronic pancreatitis, long-duration smoking, and recent onset diabetes in people over 50. In these cases, clinical guidelines suggest annual endoscopic ultrasound or MRI, as endoscopic ultrasound allows obtaining high-resolution images of the pancreas from inside the digestive tract, detecting lesions of just a few millimeters. The fourth strategy is explicitly requesting pancreas-focused studies. In routine clinical practice, general checkups don't include specific evaluation of this organ, so it's essential that both the patient and primary care physician clearly indicate the need to investigate pancreatic pathology. This involves detailing in the medical request that pancreas-directed study is required, choosing the appropriate imaging modality, and if there are suggestive findings, referring the patient to a gastroenterologist or advanced endoscopy specialist to complete the evaluation. The fifth strategy is active clinical monitoring of persistent symptoms. In medicine, the timeline of a symptom is as important as its nature. Occasional indigestion may not be relevant, but one that persists daily for 3 weeks deserves attention. The same applies to involuntary weight loss, back pain without apparent cause, progressive jaundice, or sudden loss of blood sugar control. Keeping a detailed record of these changes, including onset date and progression, allows the doctor to better interpret the context and decide on specific diagnostic tests. These 5 strategies form a complementary early warning system. The key isn't indiscriminately applying all tests to the entire population, but selecting patients who, due to their symptoms, history, or initial findings, have the highest probability of benefiting from them. Now, let me share 4 habits that, if you eliminate them starting today, could significantly reduce your risk of pancreatic cancer. The first habit to avoid is consuming processed meats. Products like deli meats, sausages, bacon, and cured ham contain nitrites and nitrates that convert to nitrosamines in the body, compounds with high carcinogenic capacity. Additionally, smoking and curing processes generate polycyclic aromatic hydrocarbons that damage cellular DNA and promote chronic inflammation in pancreatic tissue. The second harmful habit is frequent intake of fried foods rich in saturated fats. High-temperature frying produces acrylamide and other pro-inflammatory compounds. At the same time, excess fat forces the pancreas to secrete large amounts of liposity, increasing its functional load and favoring repeated inflammatory processes that can lead to precancerous changes. The third risk factor is habitual alcohol consumption. Both ethanol and its metabolite, acetaldehyde, are direct toxins to the pancreas. Chronic intake can cause chronic pancreatitis, persistent inflammation that markedly elevates pancreatic cancer risk. Even moderate amounts maintained over time can have a cumulative harmful effect. The fourth habit to eliminate is smoking. Tobacco contains more than 70 carcinogenic compounds like benzopyrene and tobacco-specific nitrosamines, TSNAs, which reach the pancreas through the bloodstream. These compounds generate genetic mutations that favor tumor development and accelerate their progression. Smoking not only doubles pancreatic cancer risk, but also reduces treatment effectiveness in case of diagnosis. Replacing these habits with a diet based on fresh foods and vegetables, maintaining a healthy body weight, practicing regular physical activity, and avoiding consumption of toxic substances creates a biological environment less favorable for tumor development and strengthens the body's natural defense mechanisms. My dear community, pancreatic cancer is one of the most silent and lethal diseases. Not because it appears out of nowhere, but because its initial signals are subtle and easy to ignore. Throughout our time together today, we've seen that the key to confronting it lies in 2 fundamental pillars: early detection and active prevention. Recognizing symptoms like persistent indigestion, unexplained weight loss, back pain, jaundice, and sudden alterations in blood sugar control can make the difference between a timely diagnosis and a lost opportunity. But knowing how to identify them isn't enough. It's essential to apply appropriate detection strategies, advanced imaging studies, tumor marker analysis, screening in risk groups, explicit requests for pancreatic evaluation, and rigorous clinical follow-up form a shield that, when used correctly, increases the chances of acting before it's too late. At the same time, reducing exposure to factors that damage the pancreas is a direct investment in long-term health. Eliminating consumption of processed meats, fried foods, and saturated fats. Moderating or eliminating alcohol and quitting tobacco are concrete steps that any person can start today. It's not about drastic changes overnight, but conscious and sustained decisions that over time build a biological environment less favorable for the development of this disease. Your pancreatic health is largely in your hands, listening to your body, acting on warning signals, requesting necessary tests, and adopting protective habits can not only save your life but also the lives of the people you love. Don't wait for the silence of this disease to become an irreversible diagnosis. Take control now. Thank you so much for being part of our health community today. Your attention to this critical information shows how much you care about your well-being and the well-being of those around you. If this video helped you understand something new about pancreatic health, please give it a thumbs up. It truly helps us reach more people who need this information. I'd love to hear from you in the comments. Have you experienced any of these warning signs? Do you have questions about pancreatic health? Share your thoughts because your engagement helps create the supportive community we're building together. Most importantly, if you haven't subscribed yet, please do so now and hit that notification bell. We're creating something special here, a community where we can all learn, support each other, and take charge of our health together. Every subscriber helps us grow this family and reach more people with life-saving health information. Remember, your health is your greatest treasure, and knowledge is your greatest power. Until next time, take care of yourselves and each other. I'll see you in the next video.